Hi, thanks for coming. How are you today?
Good. So just a fair warning. I just saw this job yesterday, but I took a break to take it easy. So this one is a health tech company, pharmacy. It's a little bit different. So I did add it in the chat. So
The job is
project manager role.
my screen again. Okay, so environmental social governance initiatives, cool. How'd you find this one? Just curious.
Saw LinkedIn actually. Oh,
Oh, good. Okay, so preferred PMP. Oof.
I don't have a PMP, but I do have
Paired working with,
2 years experience in project management though.
okay, 1 year of experience working within healthcare information technology, professional services, or a customer facing role. Here we go. Where's the years? 2 years, minimum 2 years. Oh, they just changed the years. It's the same. Healthcare information technology consulting. Oh.
Yeah, I haven't submitted this one yet. I saw it. Seems
If you're, yeah, it might be on. Yeah, because you need to know if it's like IT versus health information management. There's like other kinds of. So sometimes the description of the work will tell you key financial metrics, deliver customer risk reviews, product, pass. I I feel like it's one of those.
there's a lot of stuff in there for sure.
I don't like this. Like, have you been in healthcare?
I did volunteer work on it, but
Oh,
not
okay.
in the field. I did work at the health department during the
They
COVID,
want EHR. They're gonna want EHR.
like Epic, and
Yeah. It doesn't say it, which pisses me off.
is that something I should,
Wait,
consider?
what company is this? What company is this? I don't see the company.
Me sell right here. It's scroll down a little bit at the
But
bottom.
what are they? They're not healthcare, they're
Now
farm.
there's a drug dispensing cabinet. They do that kind of technology.
Oh, they're drug dispensing kind of like devices and product.
Yeah, I've
Oh,
worked with on this house. Yes.
thank you, Megan. Okay, well, we know they're real. Thank you, Megan.
Oh, that's funny.
I love that. Ugh. I think you have to be comfortable in healthcare if you're going to apply to this. And if you've only volunteered, that's my trepidation. Like if you had told me you were like an LVN or pharmacy tech or administrative assistant, um, you may not necessarily be in front of EHRs as much as it is like medical terminology, maybe. If you do want to apply to it though, you have to hit on high
Like all
level
the
project management. Like where do you feel like you have your project management experience?
it was my previous role.
Sorry, let me open up your resume again. With Nacho. Health Department, Virginia Health Department.
I was going to ask you, how can I, if I work this, the same contractor for a few years, should I able to condense those roles so I have more
Oh,
space?
the Virginia Department? Or which one?
Um, Virginia Department of Health. So I worked there from 2020 to 2022.
Were you promoted?
Yes.
Okay, you want to show that promotion then. The way you do that is you keep the company, you only have to cite the company once. You keep your dates organized next to the title. And then you don't have to, your spacing is off, by the way, so you'll have to just address that. But I
Okay.
wanted to just show you that then you lift this. I think because of the break, you can't see it, but you want to keep the title and you don't have to do this again. You just keep no space. Like there's no space between the case investigator and the COVID mitigation specialist. And you just list the company once at the top. And then it looks kind of like a thread,
Gotcha.
right? Because they'll be like, they'll see that this case investigator is just right below the COVID mitigation. And then as long as the dates show, right? So here it shows you ended April 2022 and started April 2022, they'll see that it was that promotion. And same thing here. You want to just keep the dates organized and you don't have to cite this again. And you just, I think your spacing needs to just be fixed, to be honest. I think you have too much
Make yours more condensed.
yeah, you have to just get rid of any spacing. There. So see how it's just next, right below the next one?
Yep.
And then it still sticks out. Yeah. Going back to this though, as far as your application. Yeah, you need to make a case for the healthcare. And if you can't make a case of, because were you trying to have the public health as your healthcare, or is there, oh,
Like
this,
certain aspects of it, but also my previous one, HO, as well, did the project, the PM
and what
aspect.
did you do for, yeah, what did you do in the health? Oh, that's for the project management. That's for the project management.
Right.
So then what's your experience in the healthcare when it comes to your resume?
Yeah, just
NATO?
working and then working with the nurses at the health department, not in like a hospital base, but more on COVID, but also long-term care facility and then congregate settings.
Long-term care facilities as well?
Yes.
Okay, that's your shot. So when you put in your summary, five years of experience supporting, what did they want? They wanted project management. So it needs to be 5 years of experience, or the years that you want in project management. 5 years of experience in project management. Here you can put skill sets like data management, stakeholder engagement. You could put and stakeholder engagement for within health health delivery settings, medical settings, health, health settings.
Say healthcare settings, because I did also work with the doc's offices as well.
Oh my God, I went blank. Assisted living, federally qualified health centers. what is it? County hospitals. Right? Because if you're saying you worked with the government staff, some of them are known for like county hospital or so the more you can kind of describe what kind of healthcare, not just, oh, it's a hospital. Okay, well, what kind of space was it? That I think is your best bet. And then notice that they also say proven experience with full life cycle project management implementation. Do you know what that means?
I guess from my understanding, is basically from preparing the project, like the RFI, the RFPs, and then starting the program, and then kind of have the timeline set and work throughout it to the very end.
Exactly. Yeah, so includes design, development, implementation, coordination, evaluation, reporting. I'll say that again. It includes development, design, implementation, coordination, evaluation, reporting. So if you want to like include some of those skill sets, programs, could be like development, implementation. And if you don't have any of those, if you're like, well, I haven't really done evaluation, it's like, okay, then drop it. And you're probably asking why if that's not their language. I'm saying it more so because you don't have your PMP, right?
That's
You
right.
have to build a case. So if you don't specify for them, well, what do you mean? Right? So that's why I'm giving you liberty to kind of keep adding. So like strong background in project management for development, blah, 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 of health related initiatives, right? You kind of can, does that make sense why that's worth considering?
Yes, it does. Because I did that, a lot of that for over 2 years, so it's really had to make sure that's those those keywords are implemented in there.
Yeah, and great. And it could also be about the breadth of the work, right? So here you could say nationwide. Is this like nationwide?
It is, it's, yeah, it was environmental health, but it is, we did it nationwide.
For, oh, environmental health, we need to mention that. Yeah, we haven't really mentioned enough infectious. Well, yeah, you can add to, oh, and you could put access to care or something like that. In initiatives. There. And then, so yeah, so you would keep going back to this and, right, for health-related initiatives nationwide, of nationwide. Does it read true?
Yep, does.
And notice how this is just 2 lines. This is just 2 lines packing in as much as they want to hear about their deepest desires of their ideal candidate. Right? And they're going to realize, okay, well, she doesn't have that certification, but you know what? Pull her in. She seems to know what she's talking about. That's what you want to get. The application is not to get the job. The application is get to the table. And how you get to the table is like talk to that deepest desire, but also make it easier for the HR screener to just flag you through. Be like, yep, look, full cycle project management. Here you go. Well, that's what she said. You guys figure it out in the interviews. I'm just doing my job. Right? Like that's what you have to, that's how it is. Like, you know, there's a lot of people that view your information. You don't know exactly who it is, but you got to make it easy for one person while speaking to the heart of another or the mind of another that's really looking for their ideal candidate. Okay, questions on how to kind of keep chipping away at this one?
No, thank you.
Was
I think my other
okay.
questions could be applicable for as we're like kind of applying, I guess, is like if we're applying to jobs, you know, some jobs don't even require a cover letter. Um, how can we kind of maximize that our resume if the cover letter is not required? You know, if there's no section to add that, because from the last couple months I applied, there's some roles like they're like, we just see your resume, that's it. So
Okay. I love this question because it's really easy. The answer is really easy. The only way to get hired is to include the R of hired, which is the cover letter, which is reflection. R of hired is reflection. And if you don't include that, then you're hiding. There's no hired, it's just hide. So you're never going to get hired this way. So you need to do a cover letter even when they don't ask. It's a best practice of the employment process. Even if they say, like, you can add it as a third page. Like they don't have, you know, I think I've even my mentees who tell me, and I've run into this, they only let you submit one document. Okay, we'll add the cover letter as a third page. You don't really get an excuse not to submit. And if they say only submit resume, you still have to include a cover letter. It's just part of hired is that reflection piece. That's it. That's the answer.
right. Thank
That's
you.
it, Christine. Yeah, there's no way you're going to get hired without that R. Hi, Odellis.
Hi, good morning. I had a question in terms of like the summary.
Yeah.
If you have if someone has experience like in different areas, how would you quantify that like in terms of like years of experience if it's different things that
Yeah,
you've
that's a
done?
great question. Yeah, so sometimes I break up the years. So you can say, like, for example, if Christine had I know this one was like healthcare, or one of them was like healthcare versus nonprofit. Um, and you had like one healthcare year and like 4 years in nonprofit. You can say it that way, but it has to roll a little bit. Sometimes it will be on two separate lines. So it could say like, you know, 3 years in project management, including reporting, evaluation, and coordination. And then the second line could be about the areas of, you know, 2 years experience in nonprofit and 1 year in healthcare. So it can be broken. I try not to if possible, but we do find ourselves having to break up the years, and that's okay. You just don't want to overdo it. I have found where you only need to say years twice. If you find yourself doing it 3-4 times, you're losing the point. So if you have to break it up once, that's okay. Yeah.
Thank
Thank
you.
you for that
The
question.
reason I asked was before starting grad school, I was doing like more like public service roles. And then once I started grad school, I was doing more research. So it's just learning how
What do you
to
mean public service roles?
like in community mental health or just like health in general.
Okay, yeah. They sometimes this is called social services, social sciences, public sector, public service, public health, health related. So you're gonna find yourself having to just be comfortable like, oh, okay. It's all community engagement, community outreach, community facing, right? So it was more just to help you be comfortable with, oh, okay, I have to be okay kind of seeing myself these different ways. Yeah,
Thank
yeah,
you.
You're welcome. Yeah. All right, everyone. It's 10 after 10 here in LA, and I'm going to log us off. Thank you so much for joining Active Job Application Lab. Hope this was super helpful.